Hello and welcome to your Alive Back Pain Relief class. My name is Betka and I'm so glad you're here because today we are going to do very simple and easy to follow exercises to relieve back pain. All right, you don't need any special equipment except a soft surface to lay on. Let's get started. And today we are going to start on our hands and knees. So get onto your hands and knees. And we are going to separate our knees hip distance apart. So you are going to have your knees right underneath your hips and have your hands right underneath your shoulders. And then we're just going to take a big breath in through the nose. And then as you exhale, you are going to tilt your pelvis and send your low back up to the sky. And then as you inhale, drop it back down. And then again, as you exhale, low back goes up to the sky. And then as you inhale, drop it back down. And then keep moving. Very good. As you exhale, all the way up, inhale back down. Now, clinical guidelines actually recommend exercise when you're dealing with chronic back pain, okay? So if you're dealing with more than 3 months, exercise is actually within your pain tolerance is actually one of the best things you can do, because when you're exercising, your body is releasing endorphins, and that's our body's natural painkiller, as well as you are reducing inflammation. Okay, very good. Now on the next one, take a big breath in through the nose, and then as you exhale, send your whole spine up to the sky and then drop it back down. And then also your spine is less vascularized, so there is no blood flow. It's not like your bone, okay? If you break your bone, it takes 4 to 6 weeks to heal, but if there is anything with your spine, it takes 12 to 18 months. And this is exactly why it relies on movement for daily nourishment. And this is exactly why I created this program. This is your reminder to move your spine daily with me. Very good. One more. Nice. Okay, now we are going to add some hip mobility as well. As you inhale, you are going to bring your right knee under your belly and think about creating a very small shape with your body. Okay, so your nose is almost touching that right kneecap. Again, work within your pain tolerance and move as much as you can. And then as you exhale, slide that right foot away from you, extend your knee, and then look up to the sky. Now you have the option to hover or even lift that right leg up to the sky. You don't have to. You can keep it on the floor, okay? And then again, slide it back. Think about a small shape and then a big shape, or you can even lift it up, okay? Now, when you are lifting your leg up, you are actually loading your back, which is not a bad thing. It's actually good for you if it is within your pain tolerance, okay? Because of course we want to make our body resilient as well, but one step at a time. Okay, one more on this side. And now we are going to switch. Okay, so now the left foot, knee comes in, slide the foot away, look up. You can even hover or lift up as far as you can. Nice. And then just keep moving your body. 2 more. And then 1 more. Nice. Have your knees together and feet together. Imagine we glued your knees together, okay? So we are going to drop the pelvis to one side, to the left side, and I'm looking to the right, to the opposite direction. And then we're gonna bring it back in, and now we are moving to the other side. So keep moving side to side. So the same principle. Start small and just feel how your body is reacting to this movement on your back. And then once it feels good, maybe you can move a little bit bigger, or maybe today is not the day. That's absolutely fine. Listen to your body. You do you. Very good. And then we're gonna do 1 more each side. 1 to the left and then 1 to the right. and then bring it back. Now we are going to separate our knees to hip width apart again, and then sit back on your heels. If your knee is stiff, you can keep your pelvis above your knees, okay? And then we are going to lower our waistband down as far as we can towards the mat. And then we're gonna look up to the sky. Keep your elbows locked. And then again, we're gonna sit back on our heels. So this is flexion of the spine. And then this is extension. Now, many of my patients have trouble to go all the way with the pelvis because their low back hurts. Now we have a solution. We have actually a couple of options. You don't go all the way. You just keep it in mid-range, okay? As I said in the beginning of our session, really important to work within your pain tolerance. So do as much as you can today. And then you can come back to this video and maybe next time you will be able to move a little bit bigger. Very good. So this is a little bit of a flexion and this is extension of the spine. Good. And then let's do 2 more here. And then 1 more. Nice. And now we are going to sit with our feet in front of us, hip distance apart, and then hold onto your knees or onto your shin. And then as you inhale, you are going to create a C curve with your spine. Drop your chin. Very good. And then roll halfway back. And then as you exhale, you are going to sit up nice and tall and lift your chest up to the sky. And then I would like you to move your head up to the sky. Very good. So we are extending our cervical spine as well. So now this is flexion and this is extension. Very good. So in every session, we do everything what a spine can do. Flexion, extension, rotation, and then side bending. Very good. Let's do 2 more here. Now, if you feel confident and comfortable, you can actually let go of your legs and then your core will turn on more, right? Because you're not supporting your torso. So you are rolling halfway back and then you can sit up. Very good. So now we are actually working on our abs as well and our core. But only if you feel comfortable with this movement. You don't have to do this. Okay, let's do 2 more. And then 1 more. And now we are going to rotate the spine. So we are going to turn to the right and then bring your right elbow kind of like behind you and look behind you. Look towards that right elbow and then we're going to bring it back. And now we're going to do the same to the left. And then back. Very good. And then the right. Now most of our rotation actually comes from our thoracic spine, which is the mid-back. Kind of like between the shoulder blade area. Our lumbar spine, our low back is not really good at rotating, so it's a little bit of an anatomy for you. Not because you need to know it. Very good. And then let's do 1 more to the right, bring it back, and then 1 more to the left. Very good. So this was a rotation. Now we're gonna lay down on our back. We are almost finished. I think we have 3 minutes left of this session. Okay, so bring your feet very close to your booty. Have your arms down by your side. And first, we are just going to do some pelvic tilts here. So when you have your pelvis or your spine in neutral, you are actually able to fit your hand behind or under your low back. But when you are tilting or curling your tailbone off the mat, you're actually jamming your low back down against the floor, okay? And then we are going to move the tailbone back. So we are rocking on our pelvis back and forth and feel how the pelvis alters the shape of your low back. Down and then back up. Beautiful. And then you are moving from the pelvis, so don't move from the feet. So we are moving, rocking on our pelvis. And then actually we are using our abdominal muscles to do that. Nice. On the next one, hold it there. So jam your low back down against the floor, or if you're in bed, against the bed. And then we are going to hover the pelvis just off the floor. And then we're going to move it back down. And then again, lift a little bit higher if you can. And then lower back down. And on the next one, lift up as far as it feels good, as far as you can. And then we're gonna lower back down. And then again, lift up. When you are lifting your pelvis up like this, you are using your hamstrings and then your back extensor muscles. And we have 3 of them. And then they run next to our spine from the head all the way down to our pelvis. Now let's do 3 more of this movement. Again, lift as far as it feels good for you. And then 2 more. And then 1 more. Beautiful. And then we are going to hug our knees. Nice. And then we are going to sit up, and we have 1 exercise left for today. And that is called the side bend. You can have your legs crisscross. You can sit in a chair or on the side of your bed, or you can even have your legs out in a big V in front of you if you feel tight through your inner thighs or your hamstrings. Have your left hand down by your side. We are going to soften the left elbow. Right arm goes up, side bend. Take a breath in. And then as you exhale, reach all the way up to the sky. And now the left arm comes above our head. And then just keep moving side to side. Again, move as far as it feels good for your body. Nice. And then 1 more. And then sit all the way up. Interlace your fingers above your head. Look up. Take a breath in. And then as you exhale, lower your arms down by your side. And thank you so much for being here with me and moving with me. If this video helped you, please like it. Comment it where you were watching from. I would love to hear from you. And subscribe to my channel so you don't miss any future sessions that are designed for people with back pain. Have a wonderful Tuesday, and I see you on Thursday morning at 8:45 a.m. Central US time. Bye.